I was taking a shower one morning and I felt something on the right side of my breast, and that was at the end of July, and I went to the doctors the next week and ultimately had a biopsy and was diagnosed in the beginning of September of 2012. When I first got the diagnosis, I was absolutely numb. I did not believe in a million years that I would ever have breast cancer. And then you start on this whirlwind journey with trying to figure out what type of surgery you're going to have. There's questions about, is there a genetic component? And you meet all these different healthcare practitioners, and you continue to be numb, and you just kind of go through the process, and it's hard to realize that you're going through it at the time. So when I first went to the breast center, they gave me some options, and the option that I was given that completely blew me away was mastectomy. I never thought I'd have a mastectomy. I had lots of decisions to make. I had to decide if I wanted to have just the right-sided mastectomy, if I wanted to do both sides. I had to decide if I wanted reconstruction, and it was completely overwhelming. So I decided to do both sides bilateral mastectomies. I had to find a plastic surgeon based on names that they gave me. And had to have the surgeon and the plastic surgeon coordinate to schedule a date for surgery. So after the surgery, I was on an absolute high because the cancer was out of me, and I was just so relieved. And about 5 weeks later, my husband and I met with an oncologist to talk about what further treatment there would be. The treatment that I went through was chemotherapy, which was to prevent any microscopic breast cancer cells from growing in my body again. So it was a systemic treatment. And that lasted for roughly 5 months, and that was really, really hard. I lost my hair, I lost my appetite, I felt really, really horrible. But then it got better. I finished chemotherapy in April, and then I started radiation. Radiation I did every day, 5 days a week for 5 weeks, and I just finished that earlier this past week. And that is a localized treatment to make sure that any breast cancer cells that were left in the region where they took the breast cancer were killed. Now I'm just going to be maintained on pills, a pill called tamoxifen, which suppresses my estrogen, which is what fed my cancer. It was a hormone fed cancer. I'll take that for 5 years. I always went every year for my annual GYN exams. I always went for my annual mammograms. And up until the year before I was diagnosed, all my mammograms were normal. The most important thing is to know your body and to pay attention to your body, because diagnostic testing is not 100% accurate. So you have to do your monthly breast exams. You have to know your body and any changes. And you have to know when to speak up when something isn't right, and listen to your body. Know your body, listen to your body, pay attention to your body.